And can you give us a breakdown of the figures over this 3-day period?
Yeah, I sure can, Colette. The figures being released today are just under 12,000, so it is a little bit lower than some of the days last week, but I suppose when you take the last 3 days together, we're looking at approximately 38,500 positive cases, something the HSE is quite concerned about. It's also concerned about the number of people being treated in our hospital for COVID, that figure at 1625, and at the peak in January 2021 of the pandemic, we had 2,000 people being treated in our hospitals with COVID, so we are heading in that direction. Paul Reid saying to me here in Carrick-on-Shannon in the last hour that he feels that we're entering a phase, and it's something that we're going to be dealing with for a number of weeks yet.
We don't see ourselves at the peak of it, unfortunately, just now, because everything we're seeing is growing, and that's with transmission levels in the community, but equally in terms of hospitalisation. So it still feels like we're entering something rather than exiting something right now at this point in time. If and when it does begin to turn down, which evidence across Europe it will at some stage, we still expect to be seeing the impacts of this well throughout April in the healthcare system.
Now, there's over 6,000 staff members of the HSE currently out with COVID as well. That figure has gotten worse over the past 2 weeks. The HSE expecting it to get worse again next week. And they are saying to people today that they're strongly urging them to continue to wear their mask. And if you're due a booster in the coming days, to come forward and get your booster. But these numbers in our hospitals putting a massive strain on our system. And for example, in Sligo Hospital here in the northwest, there is now 6 general wards that are fully COVID wards. And another example is Kerry Hospital. That hospital has approximately 250 beds. There's currently 100 beds with COVID positive patients in it. So the HSE looking at a very difficult number of weeks ahead, and they say these numbers in our hospitals having a massive knock-on effect on non-COVID related care.